This is a demonstration of the clam. What we're going to try to do is start strengthening this hip abductor muscle against gravity. So that's the resistance, the gravitational pull. The position of the body is important. So I'm going to have Leanne hold this ball here. It'll help the abdominals to contract. And I'm going to have her, that shoulder blade stabilization, working the shoulder blade down out of the ear and connecting it onto the rib cage in the back is also important. And a downward gaze will also help to keep her core position. So the whole body stays still. The only joint we're moving here is the hip. So Leanne, I'm going to have you take a breath in. Exhale, push down into the bottom leg slightly to keep the hip on the left still as we move the hip on the right. And slowly return. Inhale, exhale, navel to spine, pressing down into the left hip to levitate the right leg. The tendency to do this, go ahead and show it the wrong way. Inhale, exhale. We tend to substitute spine rotation, and if that happens, we'll see the pelvis rotating back. So I can have Leanne try to hold, no, you stay there, but keep your pelvis on my hand here. Inhale, exhale, activate the opposite hip muscles, lift with the right leg and lower down. Another tool you could use is to take a broomstick and have her try to hold that pelvis against the broomstick. Inhale, exhale, and see it makes her a little more aware of that little bit of motion she's taking from the spine. So we're trying to isolate the hip motion by keeping the spine and pelvis nice and still. Good, and this is a tiring exercise, so we'll have her do one more repetition. Inhale, exhale, lift, and slow return is extremely important, that eccentric lengthening portion of the contraction.